Thank you very much. Is it working? Great. Thank you very much for inviting me to speak today. It's a real pleasure coming and talking about the UK's experience in organ donation. Just to give you a little bit of a background to the UK, I work within NHS Blood and Transplant, so with the organ donor organisation that covers the UK. We actually cover 7 different jurisdictions, so there's England, Scotland, Ireland, Wales. There's also the Isle of Man and Guernsey and Jersey. And to give a bit of the background to the UK, you can see our primary religion is Christian, but we actually have quite a diverse range of religions within our jurisdictions, and a very diverse population, so some 800,000, 100,000 if you look at Guernsey, and going up to sort of 66 million across the UK. So our organ donation journey started many years ago, but there were 2 key documents that I'd like to bring to your attention. The first was organs for transplants. So back in 2008, there was a report that was looking at why were our organ donor rates so low and what more could we do. It produced 14 recommendations, and it was really about changing the infrastructure around the UK to support organ donation, to make sure that potential organ donors were identified and referred and engaged with the intensive care teams, spoke to the people who were working in intensive care. It also gave us legal and ethical and clinical guidance about organ donation, so that the intensive care teams were reassured that organ donation could go ahead in a way that was legal and ethical and good clinical practice. It also meant that we recruited specialist nurses for organ donation. So again, we had people with the right training that would come in and talk to families about organ donation. And that has more than doubled our organ donor rates within 10 years. But it's not enough. We then published a further report back in 2017, taking organ transplantation to 2020, that really looked at, we need the public to play their part as well. We need that public awareness. Yes, we could do more to improve the infrastructure, and also start to shift some of the focus to make sure that everybody who wanted to donate could donate, provided it was safe, and that more importantly, we could use the organs, we could actually transplant the organs from those donors. So that was starting to shift towards transplantation as well, but it still wasn't quite enough. We still weren't quite there. And if you look at our donor rates, you can see our increase in transplantation, in the red there, our increase in donation, and the green line is our waiting list. So you can see it going down year on year, which was fantastic. And I've only gone up to 2018-19 because COVID has really impacted on on everything across the NHS, but also on donor and transplant rates. But you can see even before COVID, our waiting list figures were starting to go back up. Our transplant rates were starting to dip slightly, and our donor rates had started to level off slightly. So there's more that needs to be done, although we have made significant improvements. And that starting to increase in the transplant rate is in the waiting list is due to lots of reasons, but really comorbidities and age of donors is starting to make a real impact. And we've had more and more people sign on to the organ donor register, but the problem is our consent rate has stayed largely static. So we're getting more donors, but that's because we're approaching more people, not because more people are saying yes. So you can see we've made improvements in our consent rates, but not significant, and certainly not keeping pace with the numbers of people that are signing on to the organ donor register. Like I say, it's because we're approaching more people, not because more people are saying yes. So it's clear we need to do more to improve our consent rate, which is where the legislation comes in. So if I was giving this talk a couple of years ago, nearly all of the countries would have been still opt-in. If moving forward to this time next year, all of the UK jurisdictions will be on an opt-out basis rather than an opt-in basis. It's important that, as you've heard from everybody else today, it's a soft opt-out. So the families are always approached and their advice is respected. But it places the importance on the individual rather than the family. So we say, what would your loved one have wanted, rather than what do you want for your loved one. It's subtle, but it's a very important shift. Faith and beliefs are taken into consideration. I'll talk about that a bit more later on. Deceased organ and or tissue donation is a possibility. People have to be ordinarily resident, so they have to be actually resident within the UK. And we still encourage the population to make a decision, and the focus is on it's your choice, it's your decision, make your decision, tell your family and your loved ones what your decision is so that they know what you would have wanted to happen. And like I say, it shifts that focus. So it doesn't cover children, it doesn't cover a situation if there's a decision made on the organ donor register, if somebody lacks mental capacity, they're not living voluntarily in the country, so for example people in the armed forces or prisoners, people who've lived in the country for less than 12 months, and it doesn't cover any novel forms of donation, so things like limb donation or face transplantation. That doesn't mean that children and people who are ordinarily resident don't get approached about organ donation, they do, but in those circumstances it goes back to what the family's consent. So there are challenges and benefits of introducing an opt-out legislation across the UK. For a start, just the legislation process itself. We had to consult on the public, and I would stress that we didn't consult on whether to introduce opt-out. We asked what's the best way to introduce opt-out. We would normally have 200 or so responses to a piece of consultation from the government across the UK. We had 17,000 responses that were overwhelmingly positive, giving views on what was the best way. There was no big dissent to the introduction of opt-out. And we had debate and challenge across political parties. Again, the debate and the challenge was how to introduce it, not whether to introduce it. And it gave us greater political commitment. And there are a few quotes here from our ministers. So we'll make sure that there are enough highly trained staff to make the most of the changes resulting from the bill. We'll make sure that the system is funded as it should be. There will always be a personal discussion with the family at the bedside. It's given us an opportunity to debate organ donation and what we can do as a country to improve organ donation rates. And that wouldn't have happened if we hadn't have introduced opt-out. It gave that focus. We had to make sure that we were ready, that all our teams were ready. And that was a big challenge as well. So we now have multiple organ donation laws in place across the UK, and they are subtly different. So the age of being an adult is under 16 in Scotland and people 18 in England. So there are subtle differences across the legislation, but that actually has worked in our favour. So it's increasing the likelihood that people will come to NHS Blood and Transplant because we have very highly trained teams that understand the law and understand how we apply it. We had to develop training and deliver them across all of our teams and across the NHS. But that actually created motivation within the teams. It's another benefit of the change in law. It supported engagement with the law change and improved skills and capacity and capability across the teams. We had to change our IT infrastructure, and I'll come on to that shortly. We had to change our national guidance and our policies, but again, that improved the reassurances that the clinical teams had about organ donation, and it provided clarity, and it also provided clarity for the public on faith and belief, so we improved the guidance that we have that's available for the public as well about organ donation processes. Now, we needed a lot of resources to deliver these changes. That picture there is me in the middle with my team. There was actually at one point about 120 people on my team all working to deliver these changes. But again, it drew everybody together. It drew colleagues together from across different teams, from across different parts of the NHS, and provided ownership of the legislation, so it was very easy to implement. Everybody was very supportive. I touched on faith and beliefs earlier on, and if the opt-out law has done nothing else, this level of engagement would be worth it by itself. So we now have improved faith and beliefs declarations on our organ donor register, so as well as saying, yes, I want to donate, you can tick a box to say, I have a faith or belief, and I want this to be taken into consideration as part of my donation process. And we have faith-specific cards, so people can sign on to the organ donor register and get those as well, and new pages on our website about organ donation and beliefs. And it has led to new collaborations that simply didn't exist before. They were either closed doors or people just didn't even know there was a door that was there to be open. So the conversation that that's had, as a result of the opt-out legislation, has been truly transformative. We also have an NHS app, so this is a new way that you can go on and you can see what your hospital appointments are, and you can get appointments with your doctors. In order to go onto the app, you now sign onto the organ donor register as well. You say, yes, I want to donate my organs. And for the first time, you can directly change your organ donor record. So automatically, straight away, you can see what you signed up to, and if you want to, you can change. Public engagement was a huge part of the organ donation change in law about introducing opt-out. There was some public concern regarding the law change, and we held a series of focus groups to gain a better understanding of what those concerns were, and that informed our engagement activity. A lot of that, as I mentioned, was about the faith and beliefs and how can organ donation go ahead in line with my faith and beliefs. It wasn't opt-out specific. Again, the benefit of the change in law is that it brought those myths, it brought those concerns out and got them discussed and got people talking. There was some confusion about what the law change meant, so we did a lot of work. We had adverts, TV, radio, on bus stops and so on, explaining what it means and encouraging people that it's still your choice, make your choice, talk to your family. And it gave us the largest marketing campaign that we've ever had. It was really very, very beneficial. And our awareness around organ donation, just in general, rose from 40% to 63%. It's now higher. I'll go on to those slides in a second. But it's not enough just to have the public. We did a lot of work across the team with the intensive care teams, our nurses, hospital managers, transplant teams, the hospital board. But that's not enough as well. You need the government, and you need ethics and regulators and the professional organisations, and in the UK the Royal Colleges provide the training for our clinical teams. But that's not enough either. You need the community leaders, and you need the faith leaders, and you need the patient groups all engaging as well, and you need the media, you need the press all on your side as well. So we did a lot of work with all of these different groups and more. And again, another real benefit of introducing the opt-out legislation is all of these people talking to each other. It's very, very rare that you get Parliament and ethicists all in agreement, and even parts of the Parliament, I was stressed when this was going through in England, it was when our political parties were stabbing each other in the back, and Theresa May was going out, and Boris was coming in, and Me Too, and Black Lives Matters, and so on. And yet, this got everybody talking, and this got everybody the one thing that they could agree on. And it became a little bit embarrassing, actually. It really bucked the trend across our Parliament at the time. And to get the faith groups as well and the media all agreeing with what the Parliament was trying to do was unprecedented. And this collaboration has carried on across organ donation. And we are now all still friends, and we're all there talking to each other and keeping the debate going. In terms of benefits to transplantation, as well as an introduction of opt-out, we've now got a new strategy that will take us up for the next 10 years, and our concern now is we're going to get more donors, and the government has made a commitment to 700 additional donors, 700 additional transplants as a result of introducing the legislation. So we now have a focus on transplantation services, and it's given us that drive in transplantation as well to make sure that we honour the gift. And we see it as a contract, was mentioned earlier on. So in introducing the law, we entered into a contract with the public that we will make sure that organ donation happens and transplantation happens if it's safe to do so. And we now have a shift to make sure that we're focusing on those transplant rates. So in terms of the impact of introducing the legislation, The circle, the pink circle that you can see there, we introduced our legislation in England at the very height of the COVID pandemic. It's our second anniversary on Friday, so it'll be 2 years on Friday since we introduced the legislation. And COVID has had such an impact that I'm not going to be covering the COVID years because it's had too much of an impact, so I'll be focusing more on the previous years. We lost a lot of our team members that went back to the front line to support COVID and so on, so it had a huge impact. But if we look at the outcomes from Wales, so they introduced their legislation first back in 2015, and if you look for donation after brain death, so DCD, so the one on the left as you're looking at it there, the dots basically show statistical significance, and as soon as a dot enters one of the blue boxes at the top or at the bottom, it means there's statistical significance for that law change. So you can see for donation after brain death, the dots have entered the blue box, which means Wales wins. Wales had statistical significance for their law change making a difference. For DCD, it's not there yet, or it wasn't there back in 2018, but you can see the upward trend of the dots. And for consent for donation after brain death in Wales, their rates were starting to reach 83%, which is up there with Spain. Like I say, COVID is making an impact, but if you look at the consent rates there, you can see everybody started to increase, but Wales was winning. So in terms of the public, we now have over 40% of the public opted in. It's over 50% of the public in Scotland. 6% in Wales have opted out. We were predicting 6% in England as well, particularly as England's population is more diverse than Wales, and we know that there's still some reluctance amongst particularly Black and Asian communities, but we're only at 3% of the population that's opted out, so we've not hit anywhere near, although it is still early days. Awareness of the law change in England is now around 78%, and general awareness of organ donation is increasing as well. And you can see there the clinical registrations as well, so it has led to the introduction of opt-out. It hasn't stopped people from signing on, unlike Iceland, we still have opt-in as well as opt-out on our registration. And for clinicians, for the clinical community, it's increased our referrals, it's increased the collaborative family approach, so we make sure that our teams are always there, who are highly trained to approach the families. It's increased our hospital engagement, and it's continued to improve our infrastructure, support shared learning, support the sharing of best practice. And for our campaign impact, you can see there about our awareness rates, and they've stayed fairly high. There's some dips, but we're effectively driving an increase in awareness that has been sustained for several years. I'll give you a word of warning for if you do move to opt-out. Consent rates are really difficult to map, so they peak and they trough, and when they trough you feel disheartened, and when they peak you think, oh, that's it, that's done, but it doesn't. They go up and down like that, so don't start to feel disheartened if you can see a drop, because they will come back up again, but they are sort of moving steadily upwards, although COVID has again had an impact. And in terms of outcome, you can see there our projected figures. So we're looking at 16% more donors, and while the government made a commitment of 700 more transplants, we're probably looking actually at closer to 1,000 more transplants in 5 years. And there's our latest figures, so 29% of all donors were on a deemed basis, which led to 1,540 transplants from deemed donors. So in terms of lessons learned from our experience, engagement is very, very important. I can't stress it enough. Nearly all of my time was spent speaking to people, listening to what their concerns were, having honest, open discussions. And one part of the benefit was we are in NHS Lung Transplant. We don't write the law, we abide by it. So we could go in and say, it's not down to us to write the law, but if the law changes, this is what it will mean for our practice. And we could have very open, honest discussions and listen to concerns and change our policies, change our own practices, if that provided people with the reassurances that they needed. That impartial view was very important for our colleagues across the UK. I touched on the collaborative working. We had a real issue with fake news, so somebody put something out on WhatsApp with the law is changing tomorrow, the government will take your organs, you must opt out now. Complete fake news. That WhatsApp message went out 2 years before the law actually changed, but we had more opt-outs in 2 days than we'd had in the previous 5 years. So it was significant. We've learned to close it down, so look for it, learn from it, close it down as quickly as you can. And it wasn't us closing those WhatsApp messages down, it was the people that we'd engaged with beforehand that knew the truth. So they were going out to their own communities and saying, this is rubbish, ignore it. Evaluation is really important, so I would stress that whilst we all want more transplants, of course we do, you need to look at consent rates. It's not going to get you more donors opt-out, it's going to get you a higher consent rate. And you need to evaluate it over many years, really, to assess the impact. It's not a quick win, introducing opt-out, but it's a very important part of the UK's journey in improving awareness, in improving engagement, and it better reflects the UK's population, which we know is overwhelmingly supportive of organ donation. So in summary, legislation is only part of the answer. You do need that infrastructure, you do need that support for change, but it is an important part of the answer. The benefits are that it's opened previously closed doors for us, it's improved collaboration, it's given us greater insight and awareness so we can approach families better, we can have better conversations. We've improved public engagement, we've improved the information and the advice that's available, and we've got improved motivation within our clinical teams, and that's really, really tangible. Our donation teams feel re-energised, as does the clinical community by it. And for our anticipated future benefits, the government's committed to 700 additional transplants. We actually think we'll get closer to 1,000 additional transplants as a result. So thank you very much. Just to introduce these people, so Max Johnson was a little boy who campaigned very hard for a change in the law. He was in desperate need of a heart transplant. And Kira tragically died in a car accident, and her heart was donated to Max, and there you can see Kira's brother and sisters listening to Kira's heart. So the law is called Max and Kira's Law in England in their honour. Dahi, there is a little boy in need of a heart transplant in Northern Ireland. So we'll be introducing the change in law there. And Daniel Boyd was a donor on the Isle of Man, and it's Daniel's Law on the Isle of Man. So I'd also like to say I work with many, many fantastic people across the NHS, so just note them, and thank you very much.